Cancer's a leading cause of death worldwide, 10 million deaths in 2020, which translates to 11,000 deaths here in Victoria every year. More than 35,500 Victorians are diagnosed with cancer each year. Cancer has a huge economic impact on patients, on families, on the health system and society more broadly.
One of the things that was really important to us in the partnership with Deakin was to develop a program that showed the health, social and economic benefit of investing in cancer prevention and supportive care for cancer patients. So through the partnership with Deakin, we were able to develop that program of work and help us to develop the evidence base that gives us confidence that we're investing in the right areas. And it will also help to identify areas where we can improve. We want to make sure that these programs are the absolute best that they can be.
I think it's important that any service is backed with evidence. Anything that anybody is going to invest either money or time in, and I'm talking about the client or patient's time as well. If we're going to use a service, we need to know that it's a valuable use of our time, particularly when a person has been ill and they're outside their comfort zone. If they want to reach out for assistance, they need to know that that's a proven and valuable thing for them to do.
Through Nikki, I think what we've been able to see over time is how her expertise and focus on economic evaluation has really delivered benefits for our programs as well. We've seen, for example, models that look at the return on investment in the quit line, one of our most important services. We know it works from a health perspective, and Nikki's evidence was able to show it also delivers really good value for money.
There's all sorts of services that are put out there. They all need funding, and quite often that's not funding that will necessarily come from the government. And there are different bodies that work to raise funds, and you need to get back to those people and say, what is the actual value of what you're doing?
So the work that we do together underneath the partnership makes real change, and I believe that change happens because of the strength of the partnership between the two organisations, but also at that individual level.
I think the great virtue in our relationship has been the two-way exchange of knowledge and information. So we've been able to really make some great inroads into areas that have been priorities for Cancer Council, and we've learnt a lot about research, evaluation, health economics, program design from our partnership with Deakin.
And because Cancer Council Victoria do work closely with other agencies, including government, that means that the work that we do has direct relevance for those stakeholders.
As a CEO in a health organisation in what's been a challenging environment in the last few years, all of us have had to wrestle with the values that sit behind the investments that we make, but also the financial, the economic and the health dividends. And so our partnership with Deakin, I think, has been really helpful in helping us to navigate through that experience. And there's something really special about that partnership which you can feel is elevating both organisations and helping to advance their work in a really productive way.